Hey,
Yay!
there you are.
Got him.
Cool.
Hello, friend.
Hi. Thanks for
Thank,
having me. It's great to
thank you so
meet
much for
you.
joining us.
Yeah, I'm very happy to be here tonight. Hi everyone who's joined us so far. I hope a few more jump on. Um, I'm Dominic, by the way.
Hello, friends. It's Dice from OSP. It's my good friend Dominic, who I haven't seen in a very long time, who's going to talk to us today about COVID-19 and LGBTQ considerations and updates because we just got a new notification that San Diego County is back in the purple tier, whatever that means. We're going to
It's
find out.
bad. Purple, like bad, not like royal
Yeah, not like royal.
or intellectual for that matter. Just kidding. Hi everyone. Wow, we've got viewers. Yeah, thanks, Dice. Yeah, my full name is Dominic De Los Reyes. I actually used to work at Our Safe Place, North County, YMCA, a couple years ago, before I up and ran away to New York. But now I'm back because San Diego called me back, and yeah, I used to be a oh gosh, youth support partner. Is that my title? Hanging out back when we were all in person at the drop-in center, doing, small group discussions with youth in OSP, and that was awesome. So,
That's right.
yeah, my pronouns are they, them, and he, him. And nowadays, I'm actually working for San Diego County through a nonprofit called uh, Union of Pan Asian Communities, UPAC. The county gave UPAC some funding to help like large scale effort at stemming the COVID pandemic in our local area. So the title of my program is Community Health Worker Communication and Outreach Services, or CHWAS. I can't change that. I did not choose that, and I can't make it shorter. I wish it was like the COVID super team, but it's not. It's like we're a team of 4 people. Basically, our job is to like get as much information about COVID out there that's like true and dependable and like in the languages that people speak and like culturally sensitive too. UPAC serves a lot of different like API communities and refugee communities and stuff. So I the 3 other people, community health workers on this team, are from the Vietnamese communities, Filipino community, and they speak these languages too, as well as Karen, which is like basically refugees from Burma, a country that might also be known as Myanmar. Um, and so, it's a little harder for places like the county, for example, to get information that's like gonna actually reach these folks. Uh,
Right.
yeah. So, um, of course, I'm also gonna make sure that the information we provide is gonna be LGBTQIA plus relevant and applicable and respectful and inclusive, as well as like involving just disability justice and accessible in all these other ways, right? So, so far we've only been running since September, but we're trying to do at least 2 town halls per month with ASL interpreters and captioning and translation available and stuff like that. So feel free to join us. I'll try to send out more information about that
Yeah,
later.
we're happy to share any resources or referrals that you have for us today.
Yeah.
We're going to post this whole video, and then if more stuff comes up, please feel free to share it, and we'll post it as widely as we can.
Yeah, yeah. And depending on, what the need is. So mainly we give information and like referrals, for example, to like COVID testing sites, but we're considering starting to provide more direct services to like, for example, maybe a little more case management to make sure that folks are getting access to stuff that will help them cope with the COVID-19 pandemic.
It's
So,
right up your alley.
yeah, sorry, that was kind of a long introduction, but
Oh, that was
who are you?
great. So much.
Wear my different hats. So, um, yeah, I also wanted, if anyone has questions or comments, please type them, because this is also kind of a Q&A, right?
Yeah.
I can give like general information about COVID if y'all want, or we can go into any kind of specific topic.
Yeah,
And
let's start with the generalities. Like, what is it? What are we what are
what
we
is
talking
COVID?
about?
Yeah, okay, so basically it's a virus, right? A respiratory virus. It's actually like the second version of SARS, which folks may remember if they were around 2002, 2004-ish. It's a virus that is shaped with that has like spikes on it and it looks like a crown. So that's kind of where the corona crown name comes from. Um, and it's there's a lot of different types of coronaviruses, right? Most of them are like specific to animal species, but a few of them have figured out a way to evolve so that they can kind of jump from animals to humans. And it's kind of like there's a history of that. If you've heard of like swine flu, bird flu, right? So, but the unique thing about this one is that it comes, I guess, from bats, and it also has developed like a way to easily spread between person to person. So basically, no human has like a pre-built-in immunity to it, right?
Mhm.
Which is what kind of makes it so scary because it's not preventable, basically, unless you're just not going to be in contact with anyone who has it, right? And it mostly travels through respiratory droplets, which is like, whenever we're talking or breathing or singing or playing wind instruments, right? Chanting, anything where there's like air coming out of you, a little bit of water comes with that too, because that's just how our bodies are. But that's also the way that the virus can pass from a person that has it to anybody else. Which is also why if somebody is like touching their face or sneezing on something, uh, but it's again not even necessarily sneezing or coughing, but like basically if these droplets with COVID get on any surfaces, that's also kind of a secondary way that folks might catch it, even if they're not like face to face enough with the person that had it. So, um, being that prevention is key, right? The county has been putting out messaging around what folks can do to minimize risk of getting COVID, and that's basically keeping up hand hygiene, washing your hands frequently with soap and water, also using hand sanitizer. It's recommended at least 60% alcohol. If you don't have if you can't wash your hands as often, gloves are not really recommended because that can kind of give like a false sense of security,
Mhm.
especially if people aren't in the habit of like using them the way that the manufacturer intends them to be used, and they don't necessarily work well with hand sanitizer either. So basically, that's kind of like, it's fine to just stick to like washing your hands and hand sanitizer, right?
Totally.
But also, they're also saying try to stay at least 6 feet away from people, but it's not really like that's kind of an estimate. All of this is really an estimate, right? And it's kind of like they've been saying there's a Swiss cheese model, right? Where with each layer of preventative actions you take, you want to add as many of those as possible that you can do to kind of further minimize that risk of catching it and or spreading it, right? So yes, it's good to have hand hygiene. Yes, please wear a mask. We can also go over like what are best practices for masks, right? What makes them effective and what makes them not effective. Like hanging off the side of your face, that's not going to do anything, because the point is to catch any of the respiratory droplets that may be coming out of you. And also, it might help if somebody's sending some droplets your way, there's a little bit of a barrier there too that might help it not get into your body through any orifices, right?
The masks are a lot about helping protect other people,
Yes.
right?
Yeah, it's a consideration. And
Hmm.
so that's also kind of where there's a lot of like, cultural differences and like stigma, right? Where it's like some people consider it really rude if you're not wearing a mask around them, and others are like, oh, it's a personal choice. Like, I'm not trying to do anything to you. I just don't want to wear it. So, it's obviously difficult to, like, if there are people with very vast beliefs around that, but from a scientist and like scientific and medical community perspective, they do help. They're not perfect. None of these prevention things are perfect, but they do help.
Hmm.
Also, I mean, we could talk about symptoms of COVID. We could talk about like navigating the medical system. Um, I don't know. What do you think? We could,
Yeah, so
yeah.
my understanding is that the symptoms align with a lot of regular flu symptoms and even a lot of regular cold symptoms, and so it can be kind of hard to differentiate. In fact, I didn't really see anything that stood out except that um, the cases where COVID goes really extreme, that's the part where it really kind of differentiates itself. Is that your understanding as well?
Yeah, I'm okay. So this might be a little messy, but I do have a Venn diagram. I like make sense of the world by making Venn diagrams in my head. I don't know if anyone else is like that, but I'm like, yeah, it's finally an infographic where it's like flu is in one circle and COVID-19 is in the other circle, and then there's like a part in the middle where they overlap, where there are like symptoms and preventative things that are the same for both, because there's a lot of information out there too, right? Saying like, oh, COVID equals flu, but that's not the case, right? Um, I saw like who knows how true this is, but like cases reported to the county this season for flu season was like 18 compared to like over 300 last year.
Right.
And they're saying preventative actions from people trying to not get COVID has had a positive effect on also helping people not catch the flu, because that's also a way that you can catch the flu is like sharing respiratory droplets from an infected person to an uninfected.
Hmm.
Um, but yeah, I'm still looking up this Venn diagram. Here's a little tangent. I have been working on two computers, and one of them had to get configured today by the IT department. So I'm a little like, oh no, like,
Yeah. Uh-oh.
where are my files? Question mark. But I'll send that to folks. Oh, you know what? You can look up. There's on. Maybe you can type this somewhere, but the county website where you can see like all of the information on COVID that you would even want is coronavirus sd dot com. Let's check. If it's dot com, it's org. Yeah, it's dot com.
Nice job.
Yeah, I can do this. Coronavirus-sd.com. That is also a really great place where you can find testing sites too. There's like state-run testing sites for COVID-19 and county-run testing sites. And then there's also some like community-based organizations that are also doing theirs. And it looks like more testing sites are opening up all the time. So to get some pretty current lists of where closest to you you can get tested, you can also go to coronavirus-sd.com. There's a tab that says testing, and then it gives you these two options. One is like an interactive map if you want to be all high tech about it. Like you can type in your address and then it'll circle in like a maps thing which sites are closest to you. Or if you want to go simpler, there's like a testing sites listed by the days that they're open,
Oh,
uh,
awesome.
right
And there's
next to it.
more and more opening every day, as far as I understand.
Right. And y'all can also reach out to me directly too, and I'll, send you any kind of this type of information that you want, I'm pretty much always available. Maybe I shouldn't say that, but I mean
Yeah,
specific hours because,
within reason.
depending, yeah, it's like whatever communities we're talking to. For example, if they're a faith-based community, then we make ourselves available on the weekends if that's where we're gonna be able to talk to the majority of them. So,
Totally.
yeah, like I have no,
Um, so maybe you could talk about like what are some symptoms that would make you want to go get a test? How do you know that it's
for
time to go get
sure.
a test?
Yes. Ugh, I should have had all these things in front of me. But CDC website is also another place. Um, Perhaps it's a little, um, you know, not getting as much funding as they could. But basically, if you have like a fever, that's a big one, especially if it's like 100 or over. For example, a lot of employers will send their employees home and like just kind of assume that they have COVID until they can get tested, tell them to get tested. But different workplaces have different degree numbers for that standard. But basically, if you have a fever or chills, because that can also go along with the fever, if you get a cough or like fatigue or muscle aches that are not like you don't necessarily know where they're coming from, um, if you have any shortness of breath, difficulty breathing, that's kind of more of an emergency symptom, as well as like if your lips or fingers turn blue, that can be a sign that you're not getting enough oxygen, basically. Because one of the things that COVID can do is like it attacks the lungs, the respiratory system, and it can like build up fluid in your lungs pretty quickly. It can also cause damage to different organs like heart, kidney, liver, like some kind of necessary things. And
Gnarly.
yeah, and it's kind of like it's this is a new virus, right? So it's being researched as it's happening to people, and because it was declared a global pandemic in March, it hasn't really been resolved yet, right? It's kind of still affecting people throughout the world at different rates. And there's also it looks like there might also be slightly evolved like different versions of the same thing as
Right.
it goes around the world. So people are reacting to it differently, right? So it's like kind of hard to be so sure about how it might affect like you as an individual, right?
Right.
Saying, for example, people with type O blood tend to not have as extreme symptoms if they get it, and they tend to not show up as often with positive COVID tests compared to different blood types of people, which is not to say that if you have type O blood, you won't get it. And not to say that if you have type O blood, you're any less susceptible to passing it on to other people either, because
Right.
it's a selective problem. Um, I was also going to say that there are people who get COVID and never have any symptoms,
Right.
right? So they would never even know that they had it or have it unless they get COVID tested. And there's also different types of tests available too. There's like rapid tests, and the ones that you stick up your nose, and these will tell you like whether you have active COVID virus in your fluids in your body at the moment. There's also blood tests that can tell you whether or not you ever had it, but it doesn't really say whether you currently have it. It's more like,
Mhm.
did you develop antibodies to it?
Right.
Which is also not something everyone does. Or can not everyone develops antibodies, and those that do, it's hard to say how long those last or how
Mhm.
effective they are.
Mhm.
But there is a kind of experimental treatment that um, hospitals, for example, are doing where for people who have had COVID, got better from it, and have antibodies in their blood. If they donate blood, um, there's a new thing where they're isolating those antibodies from the blood and then giving it to people with active COVID cases to help
Mhm.
their bodies and immune systems develop antibodies to kind of combat that COVID infection. So
Right.
I think that's pretty cool, but it's not like an official or widespread thing.
Right. Right.
There are some vaccine, you know, uh, vaccines being tested right now, but none are official. And there's also like a program for if and when these vaccines are ready, how will it be rolled out and to whom? So that's kind of what the county is working on right now. There's no real like answers in that area I can provide right
Right.
now. But, again, if y'all want to connect with me, I can, there's like a registration, like Google form if anyone wants to provide some like contact information or demographics, because this is like nonprofit stuff. But I can keep in contact with y'all to keep providing all updates and information around all these things that I've been mentioning so far. Um,
Awesome.
Sorry, I'm kind of jumping all over the place, and it's like for every little thing that I mentioned, like I could probably say 5 to 10 more other things in that category. So,
Yeah. Yeah. No, I think that was a great start, a good primer. Um, since we're kind of on the topic of LGBT specifically, what
yeah.
are your thoughts around considerations for our population?
Do I want to go to historical and political route? I don't
We
know.
don't have 6 hours
I know.
today.
Okay, because like anybody in OSP talking with Dice may have heard a little bit about how possibly there might have been some unfairness to our folks in terms of medical treatment, right? And it's kind of par for the course with this brand new pandemic everyone is not ready for. Um, right? There are some comparisons here and there in editorials around like, oh, this is similar to AIDS. And then that's
Mm,
very controversial, right? I'm not saying that it is or isn't. I'm just kind of sharing that, like, as a new virus that people don't really know about enough, it's making everyone scared, and there's these like political movements to try to find a scapegoat for it, like Asians, for example. um,
right.
there are some similarities, I would say, in that maybe more attention in general could be focused on like handling it properly and helping humanity deal with the pandemic instead of like blame and you know uh,
Confusion.
throwing people under the bus and all of that. So I'm being very general, right? But basically, between when I worked at OSP and now, this is also kind of a side personal tangent. I was a trans healthcare navigator for people, for example, who had Medi-Cal. And so if y'all contact me, I can also help you with a little bit of like uh, information that can help to with navigating the medical system, um, around COVID, but then also with other identities on top of that. That might make more obstacles than typical for folks. Oh, I do want to say though that the county does have like a temporary lodging program. There's also information on that more at coronavirus-sd.com. I don't want to give too many more other websites, but I could if you email me. But basically, in if like if in the course of getting speaking with a primary care provider or medical provider, like, so your main doctor, if you don't have one, then you can always call 211 and talk to a provider who can like give you a recommendation to quarantine at home, which means if you likely have been exposed to someone with COVID, they want you to stay away from as many people as possible to minimize you passing it on to anybody else by accident. Because, oh yeah, sorry, I'm still jumping around. Like, the contagiousness thing is like, you can be contagious with COVID 2 days before any symptoms show up. Um, and that's if symptoms ever show up, right? For about half of people that get COVID, symptoms usually show up by the fifth day. But people can see a lot of other people in person in
Right.
short amounts of time, and that's also why this is spreading so quickly, because it's like really hard to tell who got it from who,
Right.
because of like how, because the symptoms aren't necessarily going along with it. So quarantine is like staying at home, and acting as if you have COVID, whether or not you know you have. And then this is also good to do like while you're waiting for test results if you take a COVID test. Isolation is if you are diagnosed with COVID-19, having had taken the test, and you need to isolate yourself for the duration of while you have it until symptoms resolve, or like at least 14 days, they say. Um, Contagiousness usually tends to go down the less you have your symptoms present. And then you're typically the most contagious on the first day that you have symptoms.
Mm.
Um, so just some things to keep in mind, right? But again, this is all kind of a spectrum of time, and also a spectrum of spatial distance,
Okay.
right? Enclosed spaces is another recommendation by the county and the state of California. Try not to be in enclosed space, because in the air, if multiple people are talking and like putting their respiratory droplets out into the air, if there's not a good airflow, meaning like at least two different sources of like fresh air coming in and out of the room, like a window and a door, for example, fans and air purifiers are also helpful, right? Then that can also raise the risk of people getting COVID, is by breathing in stale air. In New York, someone got COVID by being in an elevator after someone who had COVID was standing in it. So just to kind of give that visual.
Mm-hmm.
Sorry if I lost my train of thought. What were we talking about
That's
right
great.
before this?
That was super helpful. We were talking about access and underserved populations.
Yeah, definitely. I don't know. Like, okay, it's like, since I'm in my role working at a nonprofit, which is like apolitical, right? We don't have a stance on things. I
Right.
will, I think I can say though that since uh, elections have passed recently, the quote unquote most recent administration, right, has not acknowledged statistics that have come out in this first several months of the pandemic around LGBTQ folks, especially trans folks, not getting as much access to COVID. Like they're basically um, in I maybe this is like an opinion. It's my opinion, my observation, right, that trans folks have been more afraid to access healthcare because they expected to be discriminated against because of being trans, and therefore not given proper treatment for COVID, right? So I'll just say that that's probably a problem that
Mm-hmm.
could get more attention, but I'm
Mm-hmm.
not gonna say that I have anything more than that. But yeah, in general, right, we want to be the best advocates for ourselves that we can, because we are who we have, right? We have each other, and we want to protect each other. We want to protect our families and or the people we live with. We want to protect ourselves. We want to live long so we can get back at people who don't want us to live long, right? I don't know. We can frame it however we want, but basically, I'm of the opinion that it's a good thing for us to do everything we can to combat COVID in our own lives and little worlds, right? We do have a
Right.
certain amount of control over this, in terms of our behavior in our local environment. Um,
Yes, absolutely.
yeah,
And I
so
think a lot of people are getting tired, they're getting frustrated, they're
yeah,
agitated, there's
yeah,
a lot of information. And so
yeah,
we're kind of at this point. I think that's why we're seeing this rise in numbers, that people are just like, I don't want to be in the house anymore, and I don't want to wear a mask anymore, and this and this and this. But what
yeah,
you're saying is 100% correct, right? If you care about your individual family members that you come in contact with every day, and you take those risks when you go out to the grocery store, you're bringing that stuff home with you.
exactly. Yeah.
I did want to ask you that. So when you get home,
Mm-hmm.
let's say you go to work and then you go to the grocery store and then you come home.
Yeah.
Theoretically, your clothes are all contaminated, right?
Yeah, potentially. It depends. Like, were there a lot of people breathing on and around you where you
Yeah,
were?
let's assume
How many
that they
people were
were.
wearing masks, right?
Yeah,
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 it would be and these are all like, so these preventative actions too. It's like how inconvenient are they really if the benefit from it could be the difference between life and death, basically? Because for some people, especially if they're immunocompromised, symptoms can develop very rapidly, and it takes everyone by surprise. So
right.
if you want to change your clothes right after getting home, and also take off your shoes before walking around with them inside. That's probably a good idea.
Do you wash your hands, like you personally? What's your routine when you get home?
Okay, well, I don't want to say hypochondriac. Let's just say I'm a former dialysis technician, right?
Right,
And there are very strict, what do you call it, infection control protocols that
right,
those medical professionals have to follow because the patients they treat are especially immunocompromised, and
right.
you're working with their blood, right? So, glitter, for example, is a big no-no if you're going to be a dialysis technician. Like glitter in your life. So, if y'all know my partner, that's a problem for me. Anyway, um, but also, yeah, it's like dialysis technicians and probably a lot of nurses too will typically take off their shoes, like those kind of waterproof, like scrubbable, disinfectable shoes, non-porous. You can either put them in a bin in your car and take them off even before you get out of the car, and also spray them down or wipe them down with disinfectant wipes and products. So I do carry, like, here's my spray bottle of alcohol that I'm gonna share with y'all. I got it from IKEA, and I refill it every few days. And I basically just like am always thinking about like what surfaces have my hands touched, and,
Right.
have I touched my face recently or anywhere near where something from my hands can get into my body? Have I touched commonly touched surfaces or objects in my household that if another person who lives with me touches it, could they get what I was in contact with? Right. I also have I wash my clothes in a way that kills germs. So, there's like laundry sanitizer products, but there's also just hot water for clothes that it's okay to do that with. Um, UV light actually does kill it, depending, right? Like they did tests on different surfaces and how long it can last on different surfaces. And it lasted the longest on surfaces that were dark, basically. So, if you like to line dry your clothes, that can actually also kill germs, or leaving other like things out in the sun if that's okay with whatever the item is. Um, yeah, basically, and just kind of keeping like tidy and cleaning surfaces regularly. There's a list also online of different products that can effectively kill COVID-19, along with a lot of other viruses and germs and stuff. It's actually not that important for you to like bleach absolutely every surface of your groceries when you bring them home or soak them in alcohol, although it does like give me happy thoughts to do
Right.
that.
Feel
you
better.
know
It
it's
makes you feel
like,
better.
yeah, it makes me feel better, but it's not recommended. It's not really one of the best. It's a low likelihood of catching COVID that way. People are saying, especially because there's so much information out there, if you're only going to give your attention to certain things, be it masks,
Yeah. Yeah.
and the air droplets and how close you are to other people. There was also like a recent recommendation that came out, I think in October, around households gathering with other households that haven't previously been quarantining with each other. So basically, if they're not your roommate, they say if you're going to gather, like, first of all, don't, right?
Right.
Stay with only people that you live with, but if you are going to gather, have it be a maximum of two other households and have them be like your fixed people. Like, not two households differently every week, right? And yay, house parties are nice, but like, see if you can do it virtually, like,
Right.
or only in the yard, right?
Because
The
it's not
recommendation
just
is
that other family. It's them and all the people they came in contact with.
exactly, yeah. This is like it's an exponential risk,
Right.
basically. The more people that you're in contact with, more people are in contact with each other. And there are some like simulations online of like dots bumping into each other that can show you how quickly a virus like COVID can spread, like with or without sheltering in place, basically.
Hmm.
But for San Diego, they're saying, keep your visits to no more than 2 hours. But also, if you're on playgrounds, that's actually no more than half an hour, and no eating or drinking on the playgrounds. But anyway, um, also, you can go inside to use the restroom if the restroom is like cleaned frequently. But basically, try to keep it outside as much as possible while wearing masks, while staying at least 6 feet away from people, while using hand hygiene, right? And not sharing like food items. So, like potluck where you grab things from a pile of things, not a good idea. But individual, like disposable, single use cups and silverware and plates and all of that, where the, like let's lessen the likelihood of bodily fluids being shared, basically.
Hmm. Right.
Single servings of things. For example, my family made some like traditional like fried chicken, right? And potato salad. And we wanted to share it with the folks from, let's say, two households that every once in a while we will, COVID compatible visit with each other. We individually packaged these meals in their own like biodegradable containers and then gave it to them in a contactless way. So
Hmm.
this is all really just kind of like let the germaphobes rule. But honestly, like it's shutting down our economy,
Right.
like not even to assume people care about that necessarily, but that's also like messaging from the county. But like, let's maybe work on showing care for each other in this
Right.
way, right? It's called
Right.
this
Right.
this is the world we live in now. So
Right. Right.
um, part of our program is trying to like brainstorm. All right, well, how do we do messaging around COVID and like holidays where
Mm.
traditionally people there's a lot of meaning around people visiting with each other in person certain times of the year. So if any of you viewers would like to, you know, uh, have conversations like that with me in our program, I'm totally open to that. Yeah,
Have to make some choices, right? Everybody's going to have to make some choices about what kind of risk they want to put themselves in, their family in, traveling.
travel, yeah. Try to look up online if you have travel plans around like what are the local rules and laws that they're doing around COVID for where you're going to be, which airport, for example, you'll be flying out of, because you might need to like, have a COVID test within a certain window of time before they let you on a plane, or they might want you to like show other medical documentation or quarantine for a while after you arrive somewhere. So, if you're making travel plans, give yourself that kind of time to accommodate us being in a pandemic.
Totally.
Yeah.
Totally. Think it through first.
Yeah.
I do want to wrap up pretty soon. So, can we talk about some of the resources that are available in San Diego? And before you get started with that, I'll just say at the end of Instagram Live, you have the option to save and post the video, or you can just close it out. If you would like to save this video, you're welcome to do that. And then if you want to add any links or your contact information or anything else in the in the description section, that would be primo.
Okay, cool. Thank you. Yes. Again, I mentioned coronavirus-sd.com. That's the county website for COVID information. They also have like regular updates, some links as soon as daily, like county news. And weekly also is when the county does their calculations and lets us know like what tier we're in based on COVID results and other types of data they're gathering, like how extremely the pandemic is affecting our local area. So you can go there for that and more information. 211 also has like all the languages you could want, and also mental health resources and other things like housing support, employment support, um, and yeah, I'll also give my contact information and any other kind of questions for other local resources I can share with y'all. Sorry, I don't have more off the top of my head.
No,
There's
that's
also
great.
food distributions too, because like UPAC is just one of several programs with the same funding from the county, and it's like we all got different communities we serve in different languages. So I know that, for example, South Bay Community Services has a bunch of different days they do food distribution, and UPAC's is on Fridays up on University Avenue, Mira Mesa. And yeah, so flu shots too. Get your flu shot. I can help you find a clinic and answer questions around that too. Yeah, thanks everyone for joining, and
You're so
hopefully we
awesome,
can do
Dominic.
this again. Yeah.
Much. I appreciate you so much.
You too. Thank you. It's great to see you
You
too.
too. We'll do this again soon.
All right. Mwah.
Bye.
Bye. Hmm.